Hey, say say welcome to it. It's your favorite podcast, Mind, Body, and Legal Matters. The podcast where brains, body, and legal briefs meet, or an unlikely yet oddly satisfying three-way. I'm your co-host, Bonsu Murad, my host, Lumkile Mkhosana. And today, we're cracking more than just legal codes. We're cracking bones. Well, not literally, hopefully. In this episode, we're joined by someone who knows the skeleton inside and out. And no, it's not your nosy cousin with a gossip addiction. It's a real-life orthopedic surgeon, Dr. Nabila Goga. We'll be diving into what happens when your boards betray you and why you should think twice before attempting that backflip at your cousin's wedding. So whether you're tuning in from your office, the gym, or recovering from a heroic yet ill-advised dance wing, settle in. This is Mind, Body, and Legal Matters, and things are about to get chunky interesting. Lumkile, take it away.
Good day, I'm Lumkile Mkhosana, your host. Yes, as sponsor has already said, we have Dr. Nabila Goga. He's an orthopedic surgeon, and he's also from one group of doctors. Dr. Nabila will tell us more about the Yaku ortho joints. We welcome you, Dr. Nabila. How are you?
Thank you, Sam, for the welcome. I'm Nabila Goga, I'm an orthopedic surgeon. I practice with a team called Orthopedic Surgeon, headed up by Dr. Musculoskeletal. We are a team of orthopedic surgeons who service Johannesburg as well as Tata. And the idea is to make orthopedics accessible to everybody so that we're very keen on educating and making sure that our patients understand what they are dealing with and that we're accessible to them through this journey.
Before we go to ortho joints, who is Dr. Nabila Goga? Can you tell us more about yourself? How did you get into this practice?
Okay, so I am from Johannesburg originally, and I did my undergrad training in Victoria. During my undergrad training, I really enjoyed orthopedics. So subsequently, when I had completed my studies at internship and I was deciding what to do, I spent some time in trauma casualty where you deal all sorts of things, and I realized that I decided to pursue that as my
specialty. And how's your day? How's your day like? A normal day of practice?
So the day is checked. As a surgeon, you spend time in theatre, but you also do need to see patients and consult with patients. So on an average day, I will need to do ward routes and see my patients who are admitted in hospital, be it for post-surgery, pre-surgery, or just patients that we are managing medically. And then I also spend some time seeing outpatients. So these are patients who come in with problems and I see them and address them, or patients who have had their surgeries and now are just following up, going to check on it and make sure that everything's going well. And then we, of course, had our theatre days where we both theatre and we operate. So theatre, we have set days where we go from morning and operate through the day. But there is always the chance that we have emergency lists where someone comes in, lady with a broken bone, that's quite a bad injury, and we need to take it to theatre at night or outside of our shift. So it's a mixture from day to day.
Must be very busy. Do you have time for lunch?
I'm about to ask, and in my head, I'm like, at least Lumkile, you have a picture of what she's talking about. By the way, if you missed it, Lumkile is a qualified nurse who's been in the industry for quite a long time now. So I'm sure when she's mentioning your theatres and all of these, you know what she's talking about.
But you know, because doctors work in different hospitals.
Yeah.
You never know when they leave, if they're going to eat or they're going to somewhere else.
Which is where I get it, because truly, I'm like, you've definitely answered Lumkile's question perfectly. But because I have no idea what you're talking about, I don't even have a picture. When you say all of these things, I'm like, oh, it just sounds terrifying to me. Outside of all of that, take me through a day in your life, just outside of that. Maybe not a day in your life because it's all of everything that you just mentioned. Maybe not that, scratch that out. Outside of everything that you mentioned, what else do you do? Maybe your hobby? What's your favorite dish?
You're not in theatre. What's your impression?
Theatre. So I actually not being at home. When I'm not in theatre, I love to quiet time in the garden. I love spending my time up there.
Oh, where is this?
Movies. I love reading.
Oh, nice. Favorite genre of movie in a book?
Favorite genre of movie and a book.
Uh-huh.
So books I tend to read lots of nonfiction.
Oh, okay.
And then I have particular weakness for silly action movies.
There's a line is serious, so you have to get something silly. Yes.
Should pay. See it.
Silly action movies. But I also enjoy, I think everybody enjoys hot friends and obviously food. With regards to your question in terms of when do you actually eat, you often do with meals, right?
Can you imagine?
About back to just try to make sure I had to get breakfast and generally I have
Generally, you have supper. Gotchis. It's a rare one.
And going into business, what are your common orthopedic problems that you meet, especially related to youths? We know that our genetic patients fall there and there and get hip injuries and whatever. But we want to like concentrate on more on youth injuries now.
So the parts of youth, we tend to see the normal trauma, kids falling. So with younger kids, falling off jungle gyms is quite common. Older kids' sports injuries are very common. So especially as people become more angry on competitive sports and are dedicated, you tend to find that with that risk goes up. So lots of knee injuries, ACL injuries, ankles often also get injured. So those are the common things. You also get dislocations. It's quite a mix in terms of sports, but it's in terms of youth injuries, but it's quite common to see sports injuries in my actions.
Which sports would you say this one I will allow my child to wait a little bit until you are 16 or something like that?
So unfortunately, I think that's a bit of a tough question to answer because you also have to look at the ratio of sports that people play. So in South Africa, we get lots of soccer injuries, but that's because everybody plays soccer for sure.
Yeah.
Rugby is a high risk sport. Yeah, so that is one. If someone is not keen on it, that don't feel it's appropriate to force kids into play something that is such a high contact and high risk sport. And in our slightly older patients, we are seeing a lot of pedal injuries.
Really?
As pedal becomes more popular. Yeah.
Oh,
Pedal.
wow.
Okay. What?
I don't. Let me feel it. So paddling is somewhat of a tennis sport, but it's more. It looks very fancy. I won't even lie. So your net, your tennis, is it a net? No, it's not a net. But the thing that you use to, I forgot the name for it. That you used to.
That looks like
The racket, yes. So the racket is not netty. It's not a net, but it's something wooden. It's not wooden even. Like it's something very
Like synthetic thing that it's actually.
yeah.
It's not.
yeah.
Exactly
I'll have to go and Google it. Check what's first.
what it is. Exactly. Actually, sounds like a water sports. But anyway,
So on TikTok, there's lots of promotion of what we call bodybuilding or heavyweight lifting. Or what's your take on?
So I think with every day in life, there has to be moderation. So especially with younger kids, identifies too much heavy weight. Then I think that the book is using your body weight. And so working with your own body weight for me is always safer than doing too much additional loading. And I think especially when you're doing intensive training, you need to be doing it under the guidance of a trainer because it's very easy to have the wrong form and then you end up injuring yourself. So if you're over developing certain muscles and not utilize other muscles, you're going to end up with the imbalance in that you're impossible.
So the balance is very important.
So I think it's important to make sure that you're doing balancing of your muscles, making sure that you're strengthening, more. So strengthening everything together in one united way and making sure that there's good understanding of what you need to do. And there's someone watching your So if you're picking up a weight and you don't know how to pick up the weight, you're going to end up injuring your back.
Yes. But there is some that they're common.
Yeah. And I think it's also very important that you both slowly. So we often get injuries from people who call weekend warriors, and that actually feeds into the pedal injuries. So people who don't usually play sports, don't usually do anything, and then they decide, okay, I'm going to do something very hectic.
It's pissing yourself. It's poking yourself.
Only that time when they'll be like, I don't know where to get what. Actually, yesterday I nearly had myself. Actually, I did.
You did hurt yourself.
Yeah, after a long time, and then there was no work to do.
Sure.
So I went to the gym, tried to lift.
Why would you do that to yourself?
The mistake I did.
Yeah.
I actually smeared hand lotion before. Hands are always dry. Then as I push, the way it slipped.
Oh my.
Luckily enough, I was on a split machine, so the machine was like a canla.
At least the pride and the ego did not get in the way, and you were able to ask for help. Because sometimes it happens.
And how many of such injuries did you get?
So in terms of weekend weight,
Yes, the lifting injuries.
lifting injuries are actually not that common. Yeah, they're not very, very common. I think generally with the lifting injuries, people who do a lot of sports and who do a lot of conditioning, weightlifting, they generally, I think, work with their trainers and the conditioning. But a lot of the time, because we're from orthopedic side, we are surgeons. So usually we see patients who are more likely to need surgical management. So those patients don't need surgical management, more rehabilitation. So you don't see that need of us.
So, Ponsa, are you worried about your gym form?
I don't even lie. I've had so many injuries. I'm like, is it just my body? Am I just immune to injuries at this point, or what's happening? Because I was a friend and a bestie of the biokinetics for the longest of time because I was a netball player. And then suddenly what I learned at the time, ligaments, started giving me problems. And some said they were broken. And when I got to the biokinetics, I'm like, no, if they were broken, you wouldn't be walking. So I don't even know if it's my muscles or it's my bones. Do they even work hand in hand? I don't even understand at this point.
So muscles do work because we call it the musculoskeletal amber. And your ligaments insert onto your bone. So they all do work together, but they will be in different ways. And sometimes, depending on the quality of the bone and the quality of the ligaments, you have different injuries. So sometimes I have older patients whose bone quality might be not that great. They might end up with a bony injury, whereas in a younger person, it might be a ligamentous injury with the same mechanism. So it is one system and could be either.
I wish I knew more about your space in the healthcare space before, getting myself all stressed out and worked out and stressing for years and years, because you're just giving me all the answers that I've always needed. But I think one of the common things that we face, and I don't know if it causes frustration in your space of work, some people come to y'all with no signs of bone problems whatsoever. They do have problems somewhere, maybe a back problem, and maybe it's muscles. It has nothing to do with bones, and they come through. What are some signs that one should look out for before seeing an orthopedic specialist?
So I think traditionally, people do refer to an orthopedic specialist by your GP or your physio. But I think as time goes, very often if someone has symptoms, they will then sit and be worried and they'll learn about it. And very often we get referrals where someone has actually got a good idea of what the problem is before they eat culture.
Yeah.
But traditionally, like I said, you see your GP or your physio, often the bios will also say less patients. And if there's something that they're unsure about, they'll take this too. Because remember, we work as a multidisciplinary team. Healthcare, as Monkey knows, we are one big team, cannot function without each other. So I think you seek help from whoever is available in your area, and they can usually direct you into the right person. Of course, if you reach up a mass accident and your leg is broken, you'll come straight to us. You go and see you.
Yeah, got you. Because you'll definitely know. You're mentioning one expert in especially in varsity, one healthcare expert, Google. Would you advise me when I start feeling any type of sensation somewhere to go to Google? Would you advise one to do that?
So it's a double-edged. Google, there's often is a lot of really useful information, but there's a lot of nonsense also, and there's a lot of things that sound really scary if you don't understand. So I think that it's difficult to tell people don't look at Google at all, but always take it with a grain of salt.
Sure.
And make sure that you understand what it's about, and then speak to someone who knows before you can. But I mean, often if you've got a little bit of a sore back and you check on Google, they can get some basic stitches. They sort it. It's also knowing what to look for. So you need to check which site you look for, where the information is coming from, and make sure it's reputable.
Got you.
That's
Nice.
Would you say, as we're talking about youth injuries, would you say car injuries fall under youth injuries, or it's just everyone is involved?
I think everyone is involved in car
accidents. Yeah,
I comment
because I've seen. I used to do it also when I was younger. Tying the seatbelt behind your back, and after I've seen what it can do, yeah, it's actually can you encourage about this just to use the seatbelt properly?
I get what's wearing a seatbelt is one supportive things you can do there. And for people who have young kids, using a car seat appropriately, the right size, facing the right way, based on the standard recommendations, it's there to reduce your risk. So, of course, none of us want car accidents, but if it does happen, you want to be as safe as possible. We don't want to end up with a massive head injury. You want to try and have that deceleration so that you're not getting thrown out of the car.
Yeah.
Right. I think that is such an important thing. And now it is the law. So we should all be doing it.
Yeah. Abide by those laws, please.
The laws doesn't matter. No anxiety. I'm telling you.
Which is such an unfortunate thing.
And people like who saying they concentrate more on Google. Okay, as much as Google tells us the real stories, but we're actually looking for heroic stories than a daily life. We are looking for that person who survived, sure, instead of heart attack actually did it.
Exactly.
Yeah, that's the issue.
And I think it's important to also recall, and sort of interjecting, prevention is better than cure. I mean, right now we're talking about a simple thing as fastening your seatbelt, ensuring that your baby's car seat is, placed and correctly and everything is perfect in that area, just so we can prevent such things from happening. And I'm sure, Doc, that there are some other ways people can prevent your joints and bones and muscle injuries just on a day-to-day. Mind sharing some tips on that?
So, this is a massive topic.
Yeah.
But I think it's important that we all keep our bodies active. So if you're just sitting in one place, your body is not going to like that. You're meant the movement. So especially in this day and age where we tend to spend a lot of time sitting behind computer screens, you need to make sure that your ergonomics are good. You've got your setup that has... This is something where Google can help you a lot, actually. You assess your office setup, make sure that your screen is at the right height. You're not sitting with your head bent down, and making sure that you're sitting properly on your chair. And those things can make a very big difference to how you... In addition to that, making sure that you do take breaks. So especially in your studying, if you're an office worker, you need to get up and do your body every few hours. So you keep your muscles nice and supple. It makes a really big difference in the future. As a general rule, we should be getting lots of exercise. So you all know that cardio is really important. Yeah. Taking a walk, getting sunshine makes a big difference because that gives you your vitamin D, which is helpful for your bone health. And then, of course, eating proper food is something that we never think of, but food is your medicine.
Sure.
So we like to take all these supplements, but the reason why we eat supplements is before not eat to we eat.
Exactly.
So I think it's going back to basics and making sure that we do what's good. And so you do find that very often we're really lazy to get up and do something. But as soon as you do it, you feel really done. So it's also trying to just get through that headspace and really to that position, really motivate ourselves to do what we actually enjoy.
It's for sure. But and which conditions that of the musculoskeletal conditions that are related to food? So lack of.
I think it's it's a little bit broad in terms of what's related to food, but we do find that if you aren't, especially as you get older and tend to lose calcium, so generally as when you're pregnant, you tend to have high calcium levels. So, and those are things that we should be making sure that we help that or we supplement. Older women, as you pass menopause, you tend to have challenge in your, it's a massive change for your body. So especially for older women, bone health is very important, making sure that they eat properly, they do supplements if needed, get an etc., and also load bones. So as much as bones are hard structures and you think of them as just being a rigid thing, they are alive and they keep on changing and adapting to what you need them to do. So if you aren't using your bones, blood density will actually decrease. But by loading the body, moving it actually keeps your body healthier and stronger.
So the density increases on pressure.
The density increases based on how you load it. Yes. So friction is affected. So if you think of a person who's very been in a massive car accident and they're lying in hospital, their muscles will begin to get thinner and weaker. Their bones will lose density because it's not been lit. So think of it as being overhand, something that's ceramic and something that gets stabilization to keep healthy.
And saying that I've seen that in the gym most of the time is people where I go to, I don't know other gyms, but where I go to, I find that most is concentrated of people who are about 40. And I think it's because there is a way to going around that when you are at 40, you are losing a lot of some of your hormones that protects you or that builds your muscles. How true is it?
So the definitely are hormonal changes related to age. So that does make the difference where I think after 40, you begin to feel things a bit more. You aren't as fast as you used to be for the most part. You aren't as strong as you used to be. And as soon as you start to see how people then want to take action. I think another factor also is that memberships aren't always very cheap. So it might be that you could only afford it and no, kids saying that, yeah. And I think also very often what happens is as you get older, activities that you can do also change. So in your 20s, you might be able to run quite easily. Yeah, if you've got a little bit of wear, you had an injury or two, as you progress through life, often things that are simple like riding become more difficult. So it's easier to go to the gym where they have things like bicycles and elliptical machines to actually be able to help you and get that exercise without which you otherwise would have just done more get.
So the other thing, most conditions that when we talk to the medical practitioners, they will tell you that there are what we call pre-existing conditions that leads to a certain condition. I forgot the term. Like in case where your renal failure will be precipitated by hypertensive. What?
Yeah, comorbidity.
The comorbidities around it. Are there any comorbidities that are related to weakening of the symptom?
So there are a number of different. So you mentioned renal function. People with renal issues, they do have, because they've got changes in the lot of their body's constituents, they often end up with bone issues. Other things can be hereditary. So sometimes you get people who are born with actual weak bones. You have the genetic problem with the collagen is not normal, and so they end up being very brittle and they fracture quite easily. You get other things, so sometimes it can be other conditions that predispose you to certain issues. So something like HIV can predispose you to have it's not a very common issue, but something called ABM of the hip, where the blood supply to the hip gets affected. But often can be related to the medications that you'll be treated for your other medical issues. Or it's one of the side effects. It can be a side effect. And then you get to occupational hazards. So people who do certain sports or certain activities, like same thing, but as mentioned earlier, the ADOX, deep sea divers are at higher risk because of the pressure changes can affect the way the blood is suffuses to the head. So there are certain lifestyle factors, there are certain medical issues, there are certain droughts that can affect your body health. But these are so varied that it's hard to give you a short list of things.
Yeah, I wanted to ask if is there a way that we can actually someone can go for screening for bone conditions?
Yes, I think, it's such a broad term to say bone conditions. So I don't think that there's routine screening for all the bone conditions, but in terms of bone density, if someone is worried about their bone density for a particular reason, then you can do what we call a DEXA scan, which is a special set of x-rays that allow you to assess your bone density. This is usually recommended for our old patients or patients who have what we call a low integer factor, where with a small trauma, they end up with quite a significant injury. And if you do this and test your bone density, that will allow you to see if you need treatment. So if it's quite weak, you might be started on medication to try and build up the arm. With all medications, though, remember that they always have side effects. So we only give medication if it's needed as soon as absolutely needs. And if it's going to have it, weigh out the pros and the cons.
Speaking of the necessary stuff, this is where I come in. Truly, sometimes I be listening to my grannies and my grannies' friends during what we call stokvel. So in the township, we have our grannies and our moms come together to, I don't mean to expose, but speak about money stuff and whether they can put their monies and, cases of emergency and all. And you be hearing some ranting about how they're going to be getting a surgery soon and all of that. When is it necessary for one to go, yeah, now it's time for me to get a surgery? Sure, doctors can advise, but some patients literally go, nah, I don't want anything else. I just want surgery. Yeah.
So in terms of surgery, it depends very much on what the condition is and what the benefit for this is. So can't be when people are saying that they need their surgery for their knees or for their hips, it's when they had arthritis.
Sure.
And for this, it's generally not something that a surgeon will tell you you have to do it because it depends on how you cope. So my approach is generally that you are the individual who is living your life and you need to see what you can manage and what you can't manage. When something is reaches a point where you aren't coping with it and it's affecting your quality of life, that's when you seek medical help and that's when they will be there to guide you through the process. So they can give you advice. And at the end of the day, it's always the patient who needs to say, okay, I'm going to pull the trigger on this. This is the time now where I'm not. There are certain conditions where we would be a little bit more liking to recommend therapy. So if we're worried that things will get a lot worse if we don't operate, then we might encourage the patient a little bit vigorously.
Yeah.
But if it's something where you can wait, and the person is saying that they're not really keen, they are just managing, they're happy with it, then we don't treat the x-rays, we treat the person in their entirety.
Got you.
So that's something to keep it.
You mentioned other conditions that I thought we'll discuss later, but we can go through it. Now you just say it now. We might just.
I don't mind hopping in the meantime. I'm really excited. I'm excited. And we're going to get to a segment where we're asking some questions that people have asked, particularly students. I mean, for the most part, it's student because I'm a student and I'm obsessed with advancements. I'm obsessed with the migration from the normal way, the traditional way of doing it, to a more advanced, more online, more robotics, sort of like that. So what are the latest advancements in orthopedic surgery, such as minimally invasive techniques or robotic surgeries? Do we have those? Have they been introduced or not?
They have been. So minimally invasive techniques is basically where we're trying to reduce how much we do or the size of our incisions where it's going down. And we're always trying to get better. So we do try to constantly upgrade our techniques. We get new equipment in to try and make sure that it can produce more. So an example of a minimally invasive technique is something called an arthroscopy, where we actually make tiny little cuts or a centimeter in there, and you use cameras to go inside a joint and actually do whatever repairs we need to, but just using tiny little cuts instead of having to open the whole joint up. So that is something that's done quite commonly in orthopedics.
Yeah.
In terms of robotic surgery, this is an area that has been growing quite significantly, I think, in all fields. In terms of orthopedic surgery, what we actually do is we are now doing robot-assisted techniques for our surgery. So especially our replacements. So our knee replacements is, I think, probably the most popular surgery that we use robotics for. And it's not so much a robot doing the surgery for you, but we use the technology provided to actually guide us through the surgery. In terms of, we look at the knee, we open it up, and then we show the robot where certain points are, and then the robot can guide us in terms of where we need to cut and how we need to balance it. With some of the robotic systems, they actually have arms that come out and put in guides or even tap the going for us, but it's very limited in terms of what the robot can do, because you do need a surgeon there actually do it a lot of, for sure. It's just there as a guideline, and that also allows us to track what it looked like before, what it looked like after, and make sure that we get the balance in the way that the surgeon wants to balance it so that we can optimize the patient's outcomes.
Got you.
So you're not worried about AI?
I was about to say, every other industry in the world is like, oh no, now we have new robots newsreaders. They're going to take our jobs. We have a waitress and a waiter as a robot. So it's like, are you not worried that they're going to take over?
I would be very impressed with a robot who can actually manage surgery. You thinking it's going to be something straightforward and simple, but the human body is quite complex. So, I think we had robots who can help us.
Yeah, I wanted to you to dwell more into arthritis.
Arthritis.
Yeah, because now I've seen that there has been quite people who are younger to develop arthritis. I thought it was a disease of older people, but now you get people saying that. But also maybe it might be the issue of supplements and side effects of certain medication.
So I think one thing is that we're diagnosing it a little bit earlier. The other thing is that we also do have slightly increased rates of arthritis. So in terms of the fact that our lifestyles have also changed. So in the last few years of the last few decades, we've seen rising levels of obesity. And with increased weight, that actually increases the risk of arthritis. So people who have increased, they tend to have arthritis at a slightly earlier age, and they tend to have more severe arthritis with more severe symptoms in terms of pain. So that is one of the major factors as to why there's growing rates of arthritis. First of all, it's enough people coming where they're worried and look actually take up too much of their budget in the long term in terms of doing replacements. The second aspect is that that's referring to osteoarthritis, which is your degenerative wear and tear type of arthritis. But you also have rheumatoid arthritis or inflammatory arthritis. And this is something that is less related to weight, but more related to other conditions. So if you have people who have rheumatoid or other autoimmune issues, these tend to also affect the joints. So things like scleroderma, lupus have all had effects on the joint. And you do seem to be having quite a lot of people who are studying these issues now, Yet that now we're diagnosing if they previously didn't win. Perhaps it is that with our lifestyles, with the pollution, with the chemicals that we're exposed to, maybe they are added, some not, etc. And that this also does factor into the fact that we are seeing more arthritis and just.
Oh, and talking about that, you talking about pollution. Do you think our water has something to do with our boats hitting the cows or so?
I honestly can't comment. I don't know. That's such an interesting question, actually. Because everything is just interlinked.
Yeah, because okay. Previously, we were talking about in our last episode. We were talking about with this interviewing and all of this, and I'm talking from that point of view that when they do dialysis, they really check the water potency of fluoride and other substances that are there or minerals that are in water when they do dialyze. And when we zinc, we don't check. So that was just something that came in my mind around it. Yeah. And gout?
So gout is a completely different type of a thing, but it also can affect the joints quite a bit and can also exacerbate the need for pace nets. So gout is basically, it's a problem, it's a metabolic problem. So with certain people, the way that they process certain proteins is different type of people. They don't process it as well. So they end up with probably for crystal formation and make it also cause quite a lot of pain, quite a lot of damage to the joints, in fact. Gout tends to be treated by you could experience have gout. And for the most part, it can be controlled with medication and with feed stop changes.
There's a big difference in terms of.
Oh, it's not like arthritis. Arthritis, I've seen that it's very difficult to reverse.
So arthritis, because it's degenerative, so with gout, the damage is difficult to reverse along the time, but you can generally control the symptoms to a certain level. With arthritis, because if we're talking about osteoarthritis, it's degenerative change. So if you think of your bone, if you think of a chicken bone, you've got your bone and you've got the cartilage on your head. So when the cartilage starts to wear out, then that cartilage doesn't really heal well because it doesn't then have the same type of blood supply as most of the rest of the body. So it's quite difficult for that to then reverse once that damage has set in.
And I'm asking because I just wanted to compare and contrast because you do get those patients who come in with a sudden knee and then he's not knowing if the doctor said it's a gout or it's a arthritis. Then it's why I try to get the true. Yeah.
So the gout plus arthritis with the swollen knee, that actually is a third type of arthritis. Also, that is usually a septic arthritis. So arthritis is by a broad term, it means inflammation mounting. So you get different types. When you get that sort of hot, swollen, really painful knee, that usually, that commonly can be caused by an infection in the joint. And the infection causes usually because you need to be very warm to touch. Often the patient boy, they also have a fever, they'll struggle to walk on it, and it will be just a few days history. And that's usually a septic knee. And with a septic knee, you often have to then open it up and actually wash out the infection and get antibiotics to help control the infection. The gout care presents with a red hot swollen knee. That is something that is very confusing often to separate from a septic arthritis. And that's usually an acute gouty flare. So usually we'll then do bloods and we'll assess the patient clinically, and using different markers, we can try to differentiate between which is which. You can sometimes with the acute gout, we will take into VHA very well, you can wash it out. But usually that can't be managed medically unless it's severe. With the more treatment, and we help to settle it down.
But is there a situation whereby either is managed by amputation?
The arthritis.
Arthritis, okay.
Arthritis of gout. So gout, if it gets very infected and if we have healing for control, often people would go up to get other medical issues that are associated. And sometimes people do end up with amputations, but it's not a common occurrence.
Now, talking about the amputations, actually, we should actually talk about prevention because I think the amputation is the worst.
That's the worst. I worry them. It's so scary.
Yeah, so how prevent the two? I heard that gout can be treated, but how can we minimize it resting?
The gout.
Both arthritis of gout.
So arthritis doesn't usually to an amputation because it's wear in the joint. So usually if the pain is very severe, then our option would be to do a replacement of the joint. You will get your carrot base like in your lip. Or alternatively, if it's arthritis affecting the smaller joints, sometimes you can do what we call fusion, where we actually clean up the space between the two bones and they actually drain the bones and let them be as one. So you have a stiff area, but it helps you pain. So arthritis generally doesn't, there are ways around it. And in terms of gout, management is generally medical. So you need to see generally managed by physicians and they put you on medication to actually control the gout, as well as lots of dietary change that they get to cut on, or things like alcohol and red meat to try and keep it under control.
Well, I know everyone from Tipis is like, oh my goodness. That's the entire that's a weekend down the drain because that's all we eat.
For a person who has gout, when you do eat those things here, you're not supposed to eat. You usually eat.
So you want to stop qualify LOA?
It's gonna always you.
It does often cause a bit of symptoms that they go to tend to notice that when they eat it, it does usually clear it up.
Yeah. I love the fact that and I absolutely appreciate you, Doc, being here today because you're answering the most complex questions to the most simplest questions, right? But it really does worry me sometimes because not only do we have students asking questions because we bump into them and they ask, oh, when is the next, when are we having Lumkile come through for another edition, everything health, mind and legal matters, because we do have some burning questions. Whenever you mention certain occupations, some are taken aback or some, what did you say? Right? And it's like, oh, you didn't know that we had such a person. Do you feel that orthopedic care is accessible enough in South Africa or even in just Gauteng? Because truly, I've met some people that would, please just repeat that word again. I'm like, orthopedic. And I'm like, okay, what do they do? So do you think it's enough? It's accessible and enough?
So I think you all know that in South Africa, we don't have enough coverage when it comes to healthcare. So we do have two health systems. We've got a public healthcare system and a private healthcare system. In Gauteng specifically, in private, there's a lot of access to things like orthopedic surgeons, and we've got quite a number of them in the area. But if we look at the greater population, we definitely don't have enough ideas. The second problem is that even if we do have access, one of the major challenges in South Africa is actually facilities. So if you look at government healthcare, yes, we've got lots of surgeons, we're always ready to operate. Some are in government anymore because there weren't enough posts available. But even when I was there, often you'd be keen to operate, you'd be ready to operate, but because we had such limited support staff, we had limited PNCs, we had lots of other restrictions. So you can't actually operate at the capacity which we'd like to and actually support as many people as we'd like to. So we do have a major discrepancy in terms of our distribution of healthcare in South Africa. And we do have very low numbers of orthopedic surgeons compared to LCF more. So in South Africa, we find 7,000 orthopedic surgeons for our 63 million.
Yeah, no, that's little,
which is a major problem. Yeah, I think we also do really need to hope that our public health system can improve with time and we can actually get accessibility. Because even in private, a lot of the doctors would love to be able to work in public and support. But there is just limited facilities and limited capacity, which is quite a bad degree.
Exactly, because you look at the finances, not a lot of the majority can afford the services. But number two, someone is listening to this podcast right now and like, oh, we have a shortage of orthopedic experts or specialists. I'm going to study that. You're going to study, but there's also lack of also resources. So employability is going to be an issue as well.
Yeah, so I think one of the other difficulties in terms of orthopedic care is you do have, so we are surgical continuity, which we operate as on a product treatment. But the equipment and costs around that are also very high. So theatre costs are very high. The equipment that we use, so to do something like a knee replacement, there has to be a company that supplies those parts and that equipment. And those are all very, very expensive. So for the average person to pay for that out of pocket is so difficult. And we have to have government support to allow our population to actually benefit from these things. So it is quite a difficult in South Africa because we are so resource short.
Yeah. It's a hectic one.
Maybe it's like I may throw the spanner to the way. If they see. NHS. Are you seeing any implementation or any traces of it where you went, or is still something in a blueprint?
As far as I know, it's still in blueprint and I don't see anything concrete having up. My concerns with NHS is that our existing framework is really amazing on paper, where in public you can go in and you'll pay according to what you earn. So that idea is fantastic, but what we need is better public services. And if you look up a number of doctors, a lot of doctors would love to work in public, but there's no capacity. So my question or my concern with the NHS is how do we actually bridge the dream with the reality?
Yes, because why it comes to my mind was you talked about shortage of resources in private, but many people thought the shortage of resources is only in public. They thought if I have a medical aid or if I have, then
in private we do have, but I think you are quite well supplied and managed. So I think it's more public where we've got a massive shortage.
Because people think once this thing is introduced, then I can run to the private sector if they can't. If the government gives me, for example, government says we can only operate you in 3 months, I can run to private, and then I will be operated in 3 hours or 3 days. That's what people think. That is why they are not. I think most people, that is why they're actually supporting it. You will see that it's supported by people who cannot afford, because they're thinking we're waiting for too long for services in Para. So maybe I could go to any Netcare or clinic, rush and get the surgery I need or the treatment I need. That's why I'm asking. But if you're having 1,000 orthopedics for 63 million people, that might just be a fact.
Yeah, I think that is a bit of a fact. It is. Definitely. But I also think that one of the concerns for me in terms of medical care in South Africa is that we've got massive medical legal costs, which we aren't addressing from a government point of view. So if you're available in public and in private, because there's so many medical legal cases, that takes up a huge chunk out of your budget. And that actually drives up the cost of care. And it depletes a lot of the money that should be going towards patient care and management, but it's just going into legal fees. So that's on my major worries, is that we're looking at the NHS, but we haven't quite addressed better ways of controlling litigation and making sure that we keep those costs low.
Yeah. We just speak linked here. Like still looks extremely
excited. Yeah. Actually, we wanted to have. I think we will. Here, are looking for people who are going to chop on the medical leaders. That is what I was saying. Maybe because even waiting period can be a medical leader process. So yeah. What's
I think it's time now. The students are burning with questions. Even in our comment sections, and I'm sure they're going to be like, okay, it's. I think it's time for us to stop the with the Q&A now. I have one, two, three, only 4 today. I have one here, question coming through from Mayanda, who's a student under health science. And they have this to say: in South Africa, we see a lot of sports injuries in youth sports and even in township settings. What low-cost preventative measures would you recommend to help reduce orthopedic injuries among young athletes?
So I think for our younger athletes in low resource setting, one important thing is education. So with our training, we need to make sure that people have a good understanding of anatomy, of physiology, and of general sports science. So when kids are being trained, they'll be trained in correct techniques, how to manage things safely, and what to do if they get injured, so that they don't put themselves at risk. So this also includes your first aid gear and making sure that the people at the side of the soccer field know how to manage conditions equally and to reduce the risk of injury. The second thing is that I think one of the factors that drives up youth injuries in terms of international rates is the fact that we don't actually have off seasons as much as before. And kids they tend to play school sports, the league sports, their provincial sports, and they end up not actually having rest periods. So they are more likely to end up with repetitive strain injuries because they're pushing themselves so much. So you see it a lot in terms of like our cricket players, due to birding. In the States, it's more of the baseball players, where because they have very specific movements, those are more likely to end up with injuries if you aren't having adequate rest time. I think that's something that you need to just be aware of.
For sure.
And try to make sure that kids get generalized fitness and not just sport specific, one sport continuously. That need to actually vary up there.
Yeah. Got you. This one is actually coming through from a friend of mine, Quentin, who's studying medicine. And a lot of these questions I think you've already answered, but just in short, you can just run through them in short. What are the most common orthopedic conditions you treat in the public healthcare system? And I know you're out of there already, but just from your previous experience, Doc. And how does resource availability affect your approach to treatment?
So in the public health system, we generally deal with trauma. So remember, when you're working in a resource-strapped setting, things that aren't urgent tend to take it off a backseat. So we have big trauma departments. We run trauma theaters. It's literally a 24-hour orthopedic trauma theater because there is such high volume of trauma. In terms of, the second part of your question was?
The second part speaks about the resource availability and how it affects your approach to treatment.
Okay, so in terms of resource availability, with limited resources, you need to be quite cautious about what you can do and to assess things quite carefully in terms of what benefit versus risk take. So, for example, if you have someone RBCM and you would ideally get an MRI scan for this particular condition, so you can better assess and better plan for the surgery. In a resource strategy, you might not have access to something like MRI, or it might take you 6 months before you can do the MRI. In which case, you again need to say, okay, what is my plan? Can I start with the physio instead of going straight to surgery? And you have to really weigh up the risks and benefits of waiting for those resources before, or whether you can manage it without. So you might go in and say, let's do perhaps an ACL reconstruction without doing the MRI. Whereas in private setting, you're less likely to do that because it helps to have additional information. Although you can't get that information, you will put that patient at risk by delayed success. So that is one thing. The other thing is that sometimes you have to be a bit creative in terms of how you manage deaths. So in private, for example, you have things like boots and braces, whereas in public, you don't have access to those in simple. You expert and you modify things using materials you had available to try and get the same outcome.
Got you. Unfortunately, Lerato, we absolutely appreciate you, bestie, but your question sounds more like Quinton's one, so I'm going to skip it. But it is Lerato. Shout out to you, studying public health and policy. But Sipo's one stands out. Sipo is in physiotherapy, and they ask, what's your take on the collaboration between orthopedic surgeon and physiotherapists in ensuring patient recovery? Do you feel it's fully optimized in South Africa?
So I think it is very patient and practice, not patient, that practitioner and practice specific. We generally do try very hard to work with our physiotherapists. Our approach is generally that an NTT or multidisciplinary team approach will benefit the patient the most. So with our patients at Ortho Joints, we always try to make sure that the physiotherapists have access to us, they contact us if they have any additional information, and try to keep informed.
Yeah.
In the public sector, we also, depending on the department, and of course the resources, we do always try to make sure that we've got a good rapport and a good system between us and the physiotherapist, just all the occupational therapists, because it really does make a difference in how you manage. Of course, when you are resource strapped, it sometimes is difficult to actually manage to get everybody in the same place. But I think with the increased utility of things like WhatsApp, you can actually create these little groups where you can discuss patients without always having to be in the same place. But physios and orthopedic surgeons, you can't work. Your patient will not do well unless you have the team working with you, especially with the sports patients.
Because I have hospitalization also, long hospitalization also can affect how you have to learn to walk again. You have to learn to use your limbs again.
Another interesting thing about working physiotherapists is you often do find that because physiotherapists do very long sessions and frequent sessions with patients as they're recovering, they often get a really good understanding of what the challenges are, where the patient is struggling, and even from a psychological point of view, where a patient gets, which as a doctor or a surgeon, which you see spend a lot less time with the patient, we might not have those insights. So when you work with physiotherapists, they can actually pick up on problems which you might have missed, or you might not have grouped, but you might have missed a lot earlier. Because you might see the patient at 6 weeks and you're seeing them every week until that 6 weeks. And so it helps to actually have a very good relationship and work together.
Sure. What a good one. That was an amazing, well-informed one. It was so slow.
Can go hard.
We definitely can. But there's definitely a need to...
Yeah, at the time. Exactly. Yeah. But thank you for having... Thanks for having
us. Yeah, thanks for having us. Because you definitely brought us into your office with the insightfulness of the conversation.
It's just we have a lot of questions too. We haven't even touched our nervous system, and we're going to talk about those exercises that damage. We mentioned something about rugby, and then we didn't go deep into it. But I think we will have that other session.
Yes, Lunkil is getting excited. Let me just wrap it up. Let me help with just wrapping it up, right? That's a wrap for this episode of Mind, Body, and Legal Matters. A huge thank you goes to you, Doc. Thank you so much for gracing us with your presence, Dr. Goga. You're most welcome. And if you were able to tune in from beginning to end, then you sure did get that whole breakdown of the bones and orthopedic surgery. So we hope you found it as insightful as we did. But do you remember, whether it's your spine, your rights, or your peace of mind, it's all connected. Stay curious, stay informed, and we'll catch you next time on Mind, Body, and Legal Matters.
Thank you for talking. Thank you.